Are you considering having back surgery for a disc herniation? It is not uncommon to have a discectomy when there is a disc herniation that results in symptoms of sciatica. Welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist, and in this video, I'm going to discuss a particular study that compared the outcomes with conservative approach to managing a disc herniation in the lumbar spine, the low back, versus having the discectomy or the surgical approach to treating a disc herniation that resulted in sciatica. So first of all, disc herniations are one of the most common back injuries, and there is a cartilaginous disc that cushions the bone in the low back. And sometimes that disc, when it herniates, the fluid in there pushes out onto the nerve roots, and that's what results in the sciatica symptoms. So that's when you've got numbness and tingling that goes past the knee, or you can even have foot drops. So when the nerve gets compressed and it affects the muscles, then you can have a slapping in the foot or weakness in the ankle, difficulty in pushing off with that leg. So those are red flag symptoms, and you do want to seek help from a medical doctor if you are experiencing those. And please do consult a medical doctor. It is between you and your medical doctor on what that decision is that's going to be best for you. I do like to know what is out there, and I want to discuss one of the studies that looked from the British Medical Journal that was published back in 2016, and it's really helpful to know long term, and short term, and compare those. So the low back is a common site where the disc can be herniated. If you lean forward and you lift something really heavy, sometimes that fluid pushes onto the nerve if it exits and cuts through the annulus. So you've got an outer lining of that disc that's called the annulus, and that's ligamentous tissue. So when you're herniating a disc, you're basically tearing the ligament. And if that fluid goes out into the spinal canal, and it can cause problems because it can press on the nerve root. Let's get into this study. So we're going to talk about the study that was in the British Medical Journal published in 2016 comparing the outcome of conservative versus a surgical approach to disc herniation, and it's a prospective cohort study. There were 370 participants, 297 were in the surgical group and 73 in the conservative group. And this study also, the ones that did start the conservative approach with exercise, if it failed, they were given the option of surgery. So they didn't have to continue on if it wasn't working. That's the same way it works when you go to therapy. If you're trying to conservatively manage it, if it's not working, then you will be referred back to your doctor to get further medical investigation for what is best for you. So what happens is that material can press on the nerve root, and you can get these painful symptoms in the leg, weakness sometimes, and it can be incredibly painful, and it results usually in decreased function. So what happened is the outcomes were measured when these were divided into two groups. You've got your surgical and your non-surgical. They looked at pain, the neurogenic, the symptoms, which were the tingling and the radicular symptoms that go down into the leg, as well as the function. And so what they did find is that at 6 weeks, the surgical group had significantly less pain. So the pain went down quite quickly after the surgery. And that makes sense. If you go in and you remove the material that is pressing on the nerve that's causing the problems, then the pain can reduce quite quickly. But over time, when even going out into, and you can see that after 2 years, there were very similar. There was no significant difference. And even at the 12 weeks, it began to become similar as both groups were improving. And so one of the approaches that I like in conservative management, and this is not necessarily what was done in this case, there was different interventions that were done, But if you are receiving your education on how to prevent the dangerous pain, is what I call it, where you're pressing on the nerve root and you do exercises to take pressure off that nerve root and you retrain your positioning so that you're not compressing the nerve root, you can usually successfully manage a disc herniation if it is addressed in time. So there is what I refer to as the point of no return, where intervention that's going to be more aggressive is going to be what would be required to resolve symptoms in a much quicker manner. But this is a good study showing that the outcomes after 2 years was similar in both groups. Same thing with the neurogenic symptoms, where you've got the symptoms down into the leg. Very similar outcomes at long-term outcomes at the mid and long term. So as well as function. So you can just use this just to make a decision. Well, maybe I'll try to do the conservative and see if I start to improve. And then if it fails, then you can go and make that decision accordingly. Also, the study looked at quality of life. So it also showed that the quality of life, both the function as well as the mental, were similar in both groups. And that's good to know too, because that gives insight that conservative treatment can be an effective approach to managing a disc herniation. It does seem to match up what I've seen over the last 15 plus years as far as management conservatively. And looking at long-term outcomes, yes, it's nice to know what short-term results are, but sometimes if we can go through and manage for a little bit longer, it takes a little bit more work to do this with exercise and conservative management. But the long-term outcomes can be quite similar. So that's what this study shows. That's what I tend to see. And it just gives hope that you don't have to jump right into surgery, and you can take your time to make that best educated decision based on your symptoms, your function, what you need to be doing, and what kind of status you're in. So this isn't for everybody. Some are going to need the surgery, but some can also manage it conservatively. And that's just a little bit of information on what is out there in regards to long-term outcomes with back surgery. I hope this is of help, and have a blessed day. Thank you.